Welcome to the Dr. Ramsey Show, sponsored by Revitalize Functional Medicine. If you're looking for health tips released consistently every week, you've showed up to the right place. We're grateful that you're joining us, and now your host, Dr. Teresa Ramsey.
Hi, and welcome back to the Dr. Ramsey Show. I want to remind you of last week. We had a lovely guest on. Her name was Kelly, and we were talking about her experience here. And grateful for her. Her mom had been very well educated prior to even meeting me, and she started using creams, progesterone creams, when she was just a teenager. And Dr. Lee, we have to thank for that, because he came out with progesterone creams a long time ago and the importance of them. And then fast forward, now we know that the creams of progesterone aren't enough sometimes, and we have to take the oral capsule. Well, bioidentical progesterone is one of the safest things that we can take as women. It's not designed for men. It's our progestational or pregnancy hormone. It protects our nervous system. It's our natural sleep aid. It protects us against breast cancer. I'm so proud of my very, very low breast cancer results in my practice. And it also protects us against uterine cancer. So what I wanted to share is one of my favorite hormones, obviously. But last week I had a patient come in, and she was on the synthetic form of progesterone. This is the little tiny tablet. It's called Provera. You probably can't even see this little tiny tablet. So this is Provera. This is a synthetic form of progesterone. What's unfortunate is that there's many side effects with this medication. I would never prescribe this medication. Not only does it increase the risk of breast cancer, but it increases so many side effects that women don't need to have. When bioidentical progesterone doesn't have anything with that, and it significantly reduces breast cancer risks, I just don't know why it's used, but I'll tell you why it came on the market. In 1941, Premarin came out. That was our first estrogen for menopausal females. 10 years later, every female that had a uterus had uterine cancer. We learned, and that's why they call it practice, that you can't give a woman estrogen without progesterone and not expect her to get uterine cancer. It's called unopposed estrogen. So they used Provera in some of the big studies instead of bioidentical progesterone, when in 1989, Dr. Hargrove proved bioidentical progesterone is as safe as Provera. So I'm not sure why some of the research is done the way it is. I just wanted to share with you the importance of progesterone. And if anybody prescribes you by a synthetic Provera or norethindrone, question them on that and ask for a prescription for bioidentical progesterone. It's much better for you. You'll feel much better on it, and you'll live a longer, happier life. Thank you so much for listening to the Dr. Ramsey Show, and we will see you next week.
Thank you for joining us, and stay tuned for our episode next Tuesday. Stay healthy and happy. Until next time.